Hello audience, my name is Cedric. I will be giving a short presentation on long-term care. In my presentation, I will share comparisons of government funding and private care funding for long-term care. Chernoff, 2013 states, in 2011, national spending on long-term care reached $211 billion, which includes government payers as well as personal out-of-pocket spending. This number is not surprising, given that the MetLife Mature Market Institute reported that the annual cost of nursing home care exceeded $82,000 on average, while the cost of using home health aides for roughly 20 hours a week is nearly $22,000 per year. He also mentioned Medicaid currently pays 62% of national long-term care costs, but most seniors are not eligible for Medicaid assistance with long-term care until they exhaust or spend down their personal finances first. Now, for the private sector, Vogel, 2002, wrote, "Private sector long-term care planning is a carefully considered mix of income, investment growth and earnings, family involvement, service availability, long-term care insurance benefits, and eligibility for long-term care programs such as Medicaid. An individualized plan for private sector long-term care planning contains the tools for the client to achieve access to quality care at the right time through the exercise of individual responsibility and realistic goal setting. Public government funding programs are Medicaid and Medicare programs. This is found in Medicare.gov, which states, Medicare is a federal health insurance program for people who are 65 or older, for young people with disabilities, and people with end-stage renal disease. Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part B covers certain doctor's services, outpatient care, medical supplies, and preventive services. Part D adds prescription drug coverage to original Medicare, some Medicare cost plans, some Medicare private for fee service plans, and Medicare medical savings account plans. Part C bundles plans A, B, and D, and is also known as Medicare Advantage. CNN states, Medicaid is a government program that provides health coverage or nursing home coverage to income families, including people with disabilities and elderly needing nursing home care. Medicaid also covers long-term costs, both in a nursing home and at home care. Harrington and Kitchener, 2010, found that in 2006, 39% of nursing home residents accounted for 61% of long-term care spending by Medicaid. They also found that in 2007, public funding accounted for approximately 67% of long-term care spending, 25% in Medicare, and 42% Medicaid, which amounted to $190.4 billion. Medicare spending for long-term care is limited to post-acute and hospice care, either in a nursing home or at home. The remaining 33% of long-term care spending was paid privately out of pocket, with 11% paid for with the long-term care insurance. The U.S. has private health insurance for the general population and public health insurance for the aged and disabled. Long-term care is means tested, and about 0.6% of gross domestic product was spent on long-term care in 2010. Nursing home spending in the U.S. increased steadily from $85 billion in 2000 to $155.2 billion in 2012. The majority of nursing home revenues came from Medicare, 22.7%, and Medicaid and other government programs, 40.8% in 2012. California's 861 freestanding nursing homes had $7.4 billion in revenues from all sources in 2012, a 28% increase between 2007 and 2012. Expenditures for nursing care were 35% of total revenues in 2012, and the percent of nursing expenditures declined steadily by 11% over the study period. Nursing and ancillary therapy expenditures were a total of 48% of revenues in 2012. Ancillary expenditures increased while support services, 16.6% of the total, declined steadily as a proportion of total revenues, and property costs declined slightly. This is a report from Halliday in 2016. So, in my presentation, I discussed what private sector long-term planning is, I also discussed two government funding programs, which are Medicare and Medicaid, and what they are, and how private and public funding is spent on long-term care. And let us remember one thing: our God Almighty will provide for all of our needs according to His riches and glory. And that can be found in Philippians 4:19, the New International Version of the Bible. Thank you very much for listening, and have a great day.